I figured we could do this a couple different ways. We could start early, and like start at the beginning of the day and kind of walk forward in time through the day. Could do it that way, or we could kind of go category by category and say, this is what we do for exercise, this is what we do for, to help get good sleep, so on and so forth. Do you have a sensation which one of those you would?
Let's do a day in the life.
A day in the life?
Yeah.
Okay. So maybe we'll have one of us start with morning and kind of walk through their morning, and then the other one will go, and then we'll kind of advance in the day from there.
Okay.
Sound good?
Sounds good.
Okay. So do you want me to start?
Sure.
Okay, so I wake up usually around 6, around that time, plus or minus 30 minutes, and try to get outside right away, either to sit outside or more recently, since the kids are home, not in school anymore, trying to start my exercise right away outside, whatever I can do outside. So it may be, and it depends, there's a lot of variation in what that will be, and certainly I don't want to derail us too much on exercise, but it's some variation of coordination work, strength work, cardiovascularly intensive type work, be that steady state cardio or interval training, locomotive kind of some of the groundwork that we've been working on with some of our patients, and then really pretty basic simple gymnastics, handstands, things like that.
Fun.
So that's kind of and it just varies day by day. My programming is done by a really smart guy named Zach Feiner at APECO. Shout out to Zach. Who probably will never listen to this, but if he does, I've been working with him for a couple of years. I really like him, and so he programs 6-week phases for me, is what we call them, and there's always some strength work in there, straight arm strength and bent arm strength in the upper body, some kind of leg strength, be it using weights, or be it just using complexity, pistol variations, things like that. There's always some locomotion, some groundwork, so working on the ground, moving on the ground. There's always some mobility. This cycle it's thoracic spine mobility, so kind of trying to open up that thoracic spine. Yeah. So really trying to open up that thoracic spine, and also kind of rotating, doing some spinal rotation stuff on the mobility side. It's pretty much daily handstands, but different aspects of it. So sometimes working on a freestanding to try to get a maximum, sometimes trying to challenge what I'm doing with my legs and stay in a handstand, like doing scissors, where I open up the legs, close the legs.
I'm very impressed with your handstands and your ability to balance.
Thank you. It's taken a long time.
It's really cool.
It's taken a long time. I mean, it's if you think about kids walk in a year, I feel like, you should be able to get good at handstands within a year, but in my case, it took a lot longer.
You're not a kid.
I'm not a kid. So I'm trying to do, I think I told you this before, I'm trying to do as much of that stuff outside as possible.
Yeah.
So, and kind of combining that with that early in the day light exposure. And then really for me, the other consistent part about my day in the morning is either trying to do sauna or ice bath or both. And it varies day by day, Less time I have, the more I'm going to lean on ice baths because they're shorter. More time I have, the more sauna I'll do, and then usually it's only the weekends that I'm doing alternating sauna and ice because that takes some time.
Yeah.
But I try to put one of those in the morning. I try not to put ice on strength training days immediately afterward, just to try to make sure I'm not blunting any adaptation. But yeah, I mean, mornings for me are light exposure, getting outside, exercise generally is, that's my exercise block, and then some kind of temperature stress.
Okay.
Cold or hot. So, and then if it's hot and I'm in the sauna, that's when I'm doing the breath work or meditation or something like that. I like to do Wim Hof in the sauna because it's good. It's really good. So, but yeah, I mean, so, you could, most of my stuff is stacked in the morning, I'm sure, but I'm interested to hear about yours as well.
Okay. Well, I get up at 4:15 a.m.
Wow.
Because I like to swim. And
Up before the enemy.
yes, swim practice starts at 5 a.m. and I live about 30 minutes from the pool. So,
Oh, okay.
so yeah, up early. But on the other end, I'm also in bed early. So,
Okay.
you know, I'm preserving that sleep window as best I can.
Okay.
But yeah, up at 4:15, drag myself into the bathroom, put my swimsuit on, you know, fill up my water bottle, put my electrolytes in it, and
Yeah.
then drive to the pool.
Yeah.
So I'm in general, you know, up before the sun gets up, and sometimes depending on the time of year, I'm out of the water before the sun is up still.
Oh, okay.
So.
Okay.
So yeah, I'm getting early light exposure, but I'm wearing goggles, so it's not quite the
Oh.
same as in terms of like getting natural light in
Okay.
my eyes.
Tinted?
I do have tinted and I have untinted depending on, you know,
What's your...
yeah, because tinted is way cooler than untinted.
Looks cooler, yeah.
Yeah.
Yeah, absolutely.
And the cool factor is very important.
Yes, absolutely.
So I swim for about an hour, and I swim with the master swim team. There's a coach, which is really nice.
Nice.
Because otherwise, swimming is a very isolated sport,
Yeah.
and so it's
yeah.
nice to have others involved, even though you can't hear them, you can barely see them. But actually, I really enjoy that, like the social aspect of swimming.
Yeah. Yeah. And you get, that feedback as well, I imagine.
Yeah, yeah. And every day has a different goal. So there's a threshold day where, you know, there's basically not a lot of rest and you're trying to hold the same pace. There's a day where it's very stroke specific, so you're trying like the butterfly and the breast and the backstroke.
Okay. So you're doing all the strokes.
All the strokes, yeah.
Wow.
There's a day where it's distance, so we're just trying to, you know, build endurance. And there's a strength day, oddly enough, but you put on paddles and you put a buoy between your legs and you create a lot more drag.
Oh, yeah.
So I mean, that's why I've got these really beefy arms.
Yeah. Yeah. I imagine lats, too, must really be
Yes.
big in swimming. So.
Yeah, I mean, it's basically, you know, hanging from a bar is the equivalent of pulling the water if you're doing it right. And then the last day is sprint day. And, I mean, you're full out for, you know, 30 to 60 seconds, enough to build up a ton of lactic acid. You get a good 1 minute break and then you're going again.
Okay. Okay.
So,
Wow.
yeah.
Okay.
I'm feeling it in my legs today because every Friday we do a 100-meter kick for time. So you're going as
okay.
fast as you possibly can for 100
That's interesting.
meters.
I wouldn't think, at least, you know, without thinking about it too much, that there would be much leg work with swimming, but
Yeah.
yeah.
For the sprint type stuff, yeah, you've got to really engage your legs if you want to stay on top of the water, which is the most efficient way, and
Yeah.
then to propel yourself forward.
Yeah, yeah. I hear a lot of the records, long swim records, are first off, they're you know, the times are combined between men and women, which is always interesting. And then mostly it's women who have the records for long endurance swims. I don't know if that's true, but I've heard that.
Yeah, I'm not sure that is actually true because usually most of the records are broken up between men and women because men by far, you know, they got bigger shoulders, they're stronger, bigger hands, so they're able to pull a lot more water efficiently. So the comparison between men and women is, yeah.
I mean, I had heard it was really long open water stuff.
So like
in
miles
particular.
and miles.
Miles and miles, yeah. But I hadn't looked into it, so.
Yeah, and the other part of that could be because women carry a lot more body fat. If we're doing those longer, colder water swims, yeah, women can
Better
do, like,
buoyancy and, yeah,
yeah.
okay.
You need to, yeah, they actually have, the swimmers will put on weight prior to the event so that they have enough fuel and ability to keep their core warm for the duration of the swim.
Oh, interesting. Makes sense. And you probably get some thermal stress. Well, so, I mean, I don't know, I had never thought about this until I heard this hypothesis with Michael Phelps, and like, you know, they looked at his caloric amounts and they looked at how much he was swimming and they looked at the calories and they said there's no way he's burning the calories that he's eating just from swimming. There's got to be another factor here. And the thought was he was in a pool, and so he was having to regulate his body temperature. It's not an ice bath, but it's a cool enough pool that there's he's got to regulate his body temperature between, you know, the 75 or 80 degree pool or whatever it is, and his, you know, 98.6. And so because of that, he's burning more calories from that.
Yeah, there certainly is a piece of that to
Yeah.
his caloric burn. And then when you get out of the water and you're wet all for however long, you're burning calories or losing heat from that as well.
Oh yeah, that's true. I hadn't thought about the afterwards. Okay.
Yeah, because by the time I get home, I'm freezing, even though right now it's 80 degrees in the morning.
Yeah.
Like, I'm turning the shower on, making it super hot.
Your body's like, we need to heat up.
Yeah.
And, yeah. So, okay, cool. The other thing I've learned recently about swimming, because I have a patient who swims, is I didn't know the fluid losses that happened. I mean, you know, what I had read was like 14 to 16 ounces per hour. And that was a lot more than I thought somebody would lose swimming, but it's interesting.
Yeah, I didn't know that.
Yeah,
Yeah.
I didn't either until, like, you know, I had a patient ask me and I had to look into it. And my original thought would be it's going to be pretty minimal. 4 to 6 ounces is maybe what I had in mind, or even less. And so, yeah.
I don't know, you're sweating the whole time, you just don't realize it.
You just don't realize it, yeah. Yeah. Cool, okay. So you're doing a lot of swimming, swim-specific work in the morning. Maybe if we can step away from the need to talk about different times of the day for a second, I'm curious, do you supplement with any dry land training?
A little bit. I used to be a lot better. I would do a lot of weight training and deadlifts and squats. Now it's primarily just some pull-ups and hanging, and
Yeah.
I'm lazy.
Okay. But you can do pull-ups.
Yes, I can do pull-ups.
How many pull-ups can you do?
Right now I could probably do 7, but
Wow, that's really good.
at my best 10.
That's really good.
And that's unassisted. Yeah.
That's really good. You know, I think that I was talking about a patient about pull-ups today. You know, just training for pull-ups, even if you don't get them.
Yeah.
But certainly, I mean, you know, with women, it's a struggle, more of a struggle. You know, I think to get pull-ups.
Yeah.
I mean, certainly, I'm sure swimming helped a lot too. I mean, knowing how to activate your lats and do that kind of thing helps. But still, 7 to 10 pull-ups, that's really good.
We'll fake stand.
That's like, yeah.
I was embarrassed.
A lot
to
of
say
respect.
7.
A lot of respect coming this direction to that direction. Yeah. So great. Okay.
Well, how many pull-ups can you do?
I don't know. Chest to bar, or just
Just your chin above the bar.
shin above the bar? Probably a lot.
Okay.
Yeah, probably a lot. Chest to bar, probably 12. Yeah, I feel like I've been doing more of those recently. I haven't done just kind of a max pull-up with just kind of chin above the bar in a while, but probably in the 20s, I would imagine.
Wow.
20s to mid-20s,
That's pretty good.
somewhere in there. Yeah, I feel like, yeah, I started recently just kind of, again, Coach Zach started having me do chest to bar pull-ups again, just to really refocus on lat activation with the pull-up. So
So that means you can probably do the muscle up.
I can, yeah, I can do the
That's
muscle.
awesome.
I think if you could do 7 to 10 pull-ups, you could probably get there.
Potentially.
Yeah.
I think
How many dips can you do on the rings? Ever tried
It's
that?
so long, yeah, I don't
Okay.
know.
Okay. I mean, if you can get like 5 or more dips and 5 or more pull-ups, then usually you can work towards a muscle up. So we can talk about that
At another
some
time.
other time. But yeah.
Everyone else is one, what the heck's a muscle up?
Yeah, pulling yourself from below the rings to above the rings. So being in a hanging position and ending in a support position on the rings.
Yeah.
So, yeah, okay. So some supplemental dry land training, swimming in the morning. Anything else in the morning that you wanted to touch on?
No, nothing really exciting. I mean, after you get home, it's usually making a cup of tea, grabbing maybe something to eat, throwing down a bunch of supplements, and
Yeah.
heading to work.
So let's talk about that. Let's talk about eating. You eat breakfast?
Yes and no, depends.
Okay.
So yeah, breakfast usually is like the dried salmon bars with maple syrup, because the maple syrup makes them breakfast.
Yeah. Yeah. Just throw maple syrup on it.
Yeah. It's not as much protein as I would like, because it's only 7 grams per bar, but they taste good. It feels good in my belly, and along with tea, I do dairy, so I do heavy cream in the tea.
Yeah.
I can go like till 2 or 3 o'clock in the afternoon without needing to eat something. Most of the time I just push myself to eat something so I can get enough protein in.
Okay. And am I hearing tea over coffee?
Yes, tea over coffee.
Controversial.
But it's only because coffee hurts my stomach. And always has. I drink it and I get this pit in the bottom of my stomach. It gives me anxiety really easily, and I just do not have the same issue with tea. I love the way coffee smells, and I love to have like a cappuccino or something, but I'm destroyed if I drink it.
Okay. Fair enough. I drink some coffee in the morning. Yeah, also with heavy cream. So, and yeah, that usually is pretty sustaining. Yeah, to get me to lunch. So.
Yeah, I mean, good wallop of heavy cream, it'll take you through the day.
Yeah. Yeah, so I mean, morning is obviously a really intensive time to work on self-care behaviors for both of us. And I think, it depends person to person, but morning is often the easiest time to fit a lot of this in, for most of us. I know some people work out in the evenings, not a lot of people in the middle of the day. But, certainly you can. I've had periods of time where I split some of this stuff up, try to do breath work at the end of the day, sauna at the end of the day, whatever it may be, but it just seems having that block of time seems to be an easier overall option for, at least for me. So
it's true. Kids are in bed. Nobody really wants to talk to you at 6 or 5 in the morning.
Yeah.
Yes, it's perfect. It's isolated time, and really there are very few excuses not to do your routine or do whatever it is in the morning.
Yeah.
At the end of the day, that's totally different. You're like, I've got to finish my work. I've got to take the kids to this and that. Oh, we've got to make dinner. So, yeah. I find the morning is just the best time.
Okay. And anything else for morning? I mean, I know you do red light therapy. Maybe that's a different time of day, perhaps.
Yeah, I mean, optimally, I think red light therapy should probably be done closer to the end of the day, because that's naturally when red light is.
That's a good point.
Get the most of it. But again, I do my red light therapy when I get into the office because nobody's here. I usually, I'm here an hour before my first appointment, and I just put the light on the desk, work on a few notes or research something, get hit with all that red light. And it's just so calming and soothing, and after like 3 or 4 minutes, I forget the red light's even on. Yeah.
I mean, I like too how you're like combining it with, you're building it into like your day, but you're doing other stuff while you're doing it, so I'm definitely a fan of like stacking these health behaviors if possible. Like that's why, breathing and sauna for me usually. That way you're at least not having to have 2 separate blocks of time to do both of those. But I like how you're also building it into your workday. That's nice. So I guess we'll move to the middle part of the day, which maybe there's not much there. I don't know that there's much there for me. First meal usually is middle of the day. Some kind of protein source, meat or fish usually. Usually some fermented dairy. Usually for me, for whatever reason, I drink goat kefir at lunch. Like, it's like my lunch thing, Sometimes it's the collagen or that whole beast protein shake I was telling you about at lunch, depending on where time is. But yeah, I try to make sure that it's some amount of calories. I try to make sure there's some protein there. I usually will favor more fruit at lunchtime with the first meal. Berries, an apple, peaches. It's seasonal somewhat as well, but yeah, having some having some protein, having some fruit, and then maybe some fermented dairy is pretty much a staple of my lunch, and kind of first meal of the day, pretty much.
Sounds good.
So, I know you're, also kind of starting eating somewhere 12 to 2, 12 to 3, somewhere in there.
Yeah.
What's that usually look like for you?
Oh, it varies depending on whether or not I remember to bring some lunch or I'm scavenging around the area. So yeah, sometimes I'll hit the grocery store and get some chicken or go over to one of the restaurants and have a steak. I'm looking for some kind of a protein.
Okay.
Yeah.
Okay. Yeah.
I'm gonna say I eat my fruit primarily in the evening time. I like to kind of
okay.
end the day with something
With
sweet.
some fruit. Yeah.
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 And I'll eat any fruit. I love fruit, especially when it's cold.
Oh yeah, fruit is so good. So good. Yeah, that's interesting. Yeah, I this time of year I feel like I have it more lunch, dinner, but I feel like as we move towards the colder season, I just naturally eat less fruit.
Yeah.
Maybe there's less of it around, I don't know, but yeah, I think there's a seasonality to it for sure. So, do you do any of the honey that some folks do with paleo, carnivore, or animal-based diets?
I would say yes, but I don't make an emphasis of it.
Yeah.
If I want something sweetened, I usually sweeten it with honey. If I'm gonna bake, I usually bake with honey. But I'm not like anything intentional. Like last night I made coconut curry chicken. And I always like it to have a little bit of sweetness. I just put a dollop of honey in it, and it just gives it that, coconutty goodness.
Yeah, yeah. Just kind of I've tried to experiment with having honey on its own in some significant quantity, and never really felt good with that. So yeah, it feels better to me to kind of use it the same way you do, as kind of use it in sauces, use it in sweeteners, things like that. So
yeah, I could never just do it a full spoonful. It's too sweet. It's too sweet for me.
It's too sweet. Yeah, I agree. So okay, so we're both having some lunch, middle of the day, more or less the first meal, or first significant meal for both of us. So there's some intermittent fasting kind of built into to both of our time restricted eating, I guess is our preferred term.
Yeah.
That's kind of built into that part of that fasting and then feeding cycle kind of thing.
Yeah.
Do you look to control that window in any way, like 6 hours, 8 hours, or do you just kind of naturally?
It's become more natural, I think.
Okay.
Yeah, when I first started, I would really watch the clock and like, oh, it is 1 o'clock coming, I'm starving.
Yeah.
And now 1 o'clock passes and I get to 2 or 3 o'clock, I'm like, oh shoot, I need to eat.
I should eat something. Yeah.
So yeah, the busier I am during the day or preoccupied with something, I my body is really not talking to me to eat.
Okay.
But I do like to try to eat something earlier, because if you eat too late, then you're not hungry for dinner and you're either skipping dinner or pushing it too late in the evening.
Yeah.
I think that's a problem.
Yeah. I mean, for me, I don't strictly control it either. 12 to 1 is usually the first meal, somewhere in there. And I'm usually done eating by 6, sometimes 6:30. But I don't try to, I try not to eat too late, like you said, same thing. And once a week, I will do breakfast, lunch, and then fast 24 hours lunch to lunch.
Yeah.
Once a week. And
that's the easiest way to fast.
Oh, it's the easiest way to fast. Yeah. So I prefer to do it that way. Have a big breakfast, big lunch, start that fast, and then you're eating lunch the next day. So yeah, you don't really feel like you've restricted barely at all.
Yeah.
So yeah. Doing any other fasting? Not even so much on a daily, weekly, monthly basis, but even on a yearly or quarterly?
Basis? Yeah, I would say about, for a while I was really into fasting.
As was I.
Yeah. And I was doing like the 2 24-hour fasts a week, and then I would, throw in a 48 or a 72. But now I'm kind of like, well, just whenever it feels right. So probably more quarterly or semi-annually.
Okay. And that's usually a couple days, 3 days, 5 days?
I would say it's like, yeah, it's 2 to 3.
2 to 3. Okay. Okay.
Yeah.
Okay.
I usually hit like 48 hours and then I'm like, you know what? I'm hungry now.
I'm hungry now. It's time to eat.
Yeah.
Yeah. I don't even do those really anymore because, you know, my kids are at that age where they'll be like, why are you not eating, you know?
Yeah.
So fasting mimicking diet twice a year for me generally is the way that's usually the way I approach it. Or not, I'm not technically doing the fasting mimicking
Just
diet.
we're mimicking
But
fasting.
I'm doing
mimicking diet.
a mimicking fasting mimicking diet, yeah. And so, same spirit though, you know, low
Right.
calories, low protein, 5 days, you know, and usually twice a year. Somehow after I finish those, I always tell myself I'm going to do it every 3 months, and then 3 months comes along and I'm like, meh,
Not yet.
I'll wait 3 more months. So yeah, okay, so there's some fasting built in there, there's some time restricted eating built in there. While we're on diet, are you doing any kind of macronutrient restriction in any way, any dietary restriction in any way? Or just trying to eat, kind of approaching it from a qualitative point of view?
Yeah, it's more.
Whole unprocessed foods, that kind of
Yeah,
thing?
it's more qualitative. I really push myself to be higher protein
Okay.
because I feel like I just do better that way.
Yeah,
That I don't have to watch my weight as carefully, and I feel like if I do higher protein, I can actually tolerate more carbs
Okay.
and not put on weight.
okay.
So I find that really interesting. So
Okay.
yeah, I push the higher protein with my patients as well.
Like a gram per pound of body weight?
Yep.
Yeah,
Yep.
okay.
And
Yeah.
if they're still hungry, they're like, I'm still not getting enough calories. I'm like, then you should eat more protein.
Yeah,
And I feel like as soon as they find that magic spot,
Yeah.
then they have better control of their appetite, the weight seems to come right off, and
totally agree.
they're just more
Yeah.
functional.
Yeah, I totally agree. Yeah, definitely, especially in older people. You know, that gram per pound of body weight is a really good place to be at. But yeah, personally, I'm usually right around that level as well. I mean, if I have like Saturday, just over the past couple months, I've had this thing on Saturday where I do a really high volume, intense leg day, where your legs are sore for a few days. And that is not the best marker of exercise quality, or that's not, I know all that, but for some reason, I don't know, it's kind of nice to do that really intense leg day. You know, like right around this time of the day on Fridays, which is when we're recording this, I start getting a little nervous, you know, like I kind of like that. And those days, I may go above 1 gram per pound. And I don't know if there's much benefit there with that, quite honestly. I know that the data is like, and it depends on age, and it depends on, you know, a host of other things, but, you know, they're saying, well, you're gonna top out somewhere between, say, 1.6 and 2.0 grams, or I've even heard as high as 2.2, which would be a gram per pound, you know, 2.2 grams per kilogram body weight kind of thing, anywhere in that 1.6 to 2.2. I don't know, I feel the more protein I do after a hard workout day like that, the better I feel.
For sure.
And the better I feel I recover.
You're craving it too?
Oh yeah,
Yeah.
yeah. You know,
Your body's telling you something. Like,
yeah, that's the night you want the
You
tomahawk
burn
steak.
through- yeah.
That's the,
you burn
Yeah.
through a ton of amino acids, you need to hurry and replace those.
yeah, exactly. So yeah, there can be this variation built in based on, you know, what your workouts are like. You know, by the same respect, like, and you know, if I'm really truly sedentary, say if I'm traveling or something for a day, you know, I may eat a lot less protein, just because it's like, well, I'm not really doing much, you know. So, okay. Any other middle of the day wisdom for us?
I like to try to get outside for a few minutes.
Oh, that's a good point. Great point.
Yeah.
Get
so
some
it's like-
UV.
yeah, because I get trapped in this office all day long, and I really want to work and get my things done so that I have time at the
I'm
end of
not
the day.
trapping you in this office. Let's just put that out.
I trap myself in. But so I really will have to think about, like, okay, go outside and just walk around the parking lot, take a book or you know, something, and get
Yeah.
out in the sunshine, take my glasses off,
Yeah,
feel the warmth of the sun on my skin.
yeah,
It really helps my mood. It helps me think better. You know, I feel better about
yeah.
just
That's a
the
great
day.
point. Yeah, I try to do that during the week whenever I can as well, and definitely on the weekends. Midday sun, you know, getting that midday sun, getting some vitamin D. Yeah, totally agree.
Yeah, there's a lot of interesting information out there about what's it called, the exclusion zone and building easy water. Have you heard this term before?
Easy water? I've heard of structured water.
It's the same thing.
Oh, okay. Okay.
Yeah. So easy water is the exclusion zone that structured water creates.
Oh, okay.
And it takes radiant energy to create this structured water. So red light, infrared light, radiation from the sun.
Yeah.
So if you want to help somebody lower their blood pressure, increase energy, I mean, go outside and, you know, nature's way of improving your health is just getting out there and getting into the sun.
Yeah, nitric oxide as well.
Yes, absolutely.
Yeah, so.
Nature
A lot
is
of benefits.
full of medicine.
Mm-hmm.
It's
Absolutely.
free.
I know. So much of it's free. I know. So, good. Yeah, that's a good point. I'm glad you brought up the midday light. You know, because we should say, or at least I feel like that if it's midday light versus early daylight, there's benefits regardless, and there's overlapping benefits, but there's also going to be, you know, a bit of a, you know, more of a UV benefit midday, more of that kind of circadian benefit early.
You mean there's more than just vitamin D synthesis?
Yes, there is.
Oh, okay.
Yes, there is. All right. Well, let's move on to evening night.
Okay.
Okay. And I'm sure this is going to be where we hear about sleep.
Yeah, let's just jump right into that area because I know sleep is really something we prioritize.
Yeah.
And try to optimize. So for me, we turn the lights down in the house as best we can. We've got a teenager who always keeps every light in the house on.
Yeah.
So in order to protect my production and release of melatonin, I wear blue light blockers, which I'm sure you do
As
well.
do I. Yeah.
And yeah, these are awesome because you can buy them prescription, and they really reduce the amount of blue light going into your eyes, and it's the blue light that inhibits the release of melatonin. So you know, after your last exposure, I think of blue light, it's 30 minutes or more before that melatonin will be reduced.
Yeah.
So if you can put those blue light blockers on, kind of imitate what's going on with the lighting outside, inside your house, even though the lights are on, it's really going to help sleep quite a bit.
Yeah. Yeah, I also do blue blockers. We have the Philips Hue bulbs that I put on timers, and so they start turning yellow, orange, you know, as the night advances, and that way, you know, even if the lights are flipped on, they're at least in the right spectrum. So yeah.
I need to do that.
Yeah, it works out well. So yeah, I mean, certainly I'm wearing blue blockers as well. Temperature obviously is another kind of thing I'm looking at, you know, as I'm sure you are as well. I know you have a chili pad.
Yes.
I do too. So keeping cool as cool as you can through the night. Obviously, you don't want somebody being so cold that they're waking up all the time.
Yeah. So what is a chili pad?
A chili pad is a small mattress pad that circulates water at a preset temperature. And Chili's got several products now. They've got the original chili pad. They've got the Uller. They've got another one, Pod Pro, maybe something like that.
It's a brand
the
new
newer
one.
one.
Mm-hmm.
Yeah. But they all do the same thing. Yeah, they all do the same thing.
So the idea is to pull body heat away. You're sleeping on this nice cool pad, and the deep drop in body temperature helps to initiate sleep.
Yeah, got to have that drop in body temperature in order to get into, especially deep sleep is my understanding. You know, especially deep sleep. So yeah, this is when we're cooling down, bringing down lights. We're bringing lights to more of a yellow, orange, red spectrum if we can. We're wearing blue blockers. We are also potentially bringing lights lower in the visual field. You know, higher in the visual field is also perceived as kind of like midday sun. Lower in the visual field is perceived as like sunset kind of thing. So that's another way to kind of, interact with light. We've eaten our last meal several hours before bed, so hopefully we're going to bed with as much of an empty stomach as possible. That seems to be helpful for sleep as well. And then the bedroom environment being another key factor there.
Oh, yes.
So we talked about the chili pad.
Yep, so now we're making it as black and dark as possible. We've got the drapes completely closed, and, any ounce of light, is shuttered out.
Yep.
Electronics are not near the bed.
Yeah.
I keep mine in the bathroom and the bathroom door closed.
Yep.
'Cause I am super sensitive to lights, especially like the little green light that is
Yep.
on the fire alarm. Or
Well, you can get those little stickers. That,
Oh, and I do.
Yeah. Yep. Those are great. Yeah, that works out well.
But
Okay.
yeah, eliminating all the light. And then I also will, occasionally wear a sleep mask.
Yeah.
Just to make sure that it is completely black. And then on nights when I'm like not, as settled as I'd like to be, earplugs are magical.
Yep.
So
Earplugs.
yeah, you're cutting out all that ambient noise,
Yeah.
the dog moving or, some strange noise outside that might wake you up unexpectedly. I find earplugs are a perfect addition.
Great. Yeah, I will use pink noise sometimes as that similar idea, to drown out any of those kind of random environmental noises. So, but I also find the chili pad or the Uller is the one I have also has a little bit of white noise to it, which is nice too. So, okay, so we're kind of setting ourselves up for good sleep. Anything else with sleep that you do other than kind of control light, temperature?
Yeah, sometimes I'll take some melatonin.
Okay, yep, same here. I will do that as well. Usually, where's your dosage usually at for you?
5 milligrams is what I've found.
Yeah.
That works best for me.
Okay, yeah, I feel like I'm somewhere in that range of probably 1 to 3.
Yeah, I remember
somewhere
you
in
saying
there.
you're a little lower.
Yeah, and sometimes even, if I get the drops that have like fractional, I'll
Oh,
use
yeah.
that as well, and sometimes that helps, but you gotta kind of have that, you gotta have the glass out, and you gotta be drip. So sometimes it's easier to just grab a tablet or a pump from the Quicksilver or something like that.
Exactly, and it's
Yeah.
nice to get I always tell my patients, either get, I tell them get the gummies or get the liquid, because you don't want to have to get up, get a drink of water, find your pills, whatever.
Yeah.
If you can just grab that, and then know, okay, I'm gonna go right back to sleep.
Yeah, it's gonna kick
It's a
in.
crutch, but
It's gonna kick in
it's
a
good
lot
crutch.
quicker. Yeah. Okay, well, yeah, that's kind of our days. We'll, definitely hopefully put out more content over time that will go into each of these things in depth. I think each thing we talked about is probably a whole podcast
Oh
episode.
yeah, we could really
So,
dive deep in all
Yeah,
this.
we can really dive deep into it, and that's probably what we'll plan to do going forward. But I think this is interesting. At least people can start to at least understand what we're doing.
Yeah.
Because I get asked all the time, and I'm sure you do as well. And now we can say, well, go listen to that.
Go listen to us babble. Yeah.
All right. Well, great talking with you today, Shannon.
You
Dr.
too.
Bybee-Driscoll.
Yes, you too, Dr. Dan.
And yeah, we'll do this again soon.
Okay.
All right.